What's up, friends? It's Haley, aka Bird,
and Randy,
and you're tuning in to the Give 'em the Bird podcast.
This podcast is all about challenging what it means to be healthy and fit. It's about celebrating sustainable behavior change and non-scale victories.
And most importantly, it's about giving the bird to the diet industry and societal expectations of body size. Why? Well, because at the end of the day, you have an entire life to live that does not require your body look a certain way.
Thanks for tuning in.
Now, let's give 'em the bird. Hello, everyone, and welcome back to another episode of GTB. You got Haley and Randy here, and we are covering a doozy of a topic today, one that I feel like goes far beyond the conversation we're going to have, but it was an idea that Randy came up with, and when she said it, I was like, I feel like we have enough experience and information between the two of us that it would be helpful to talk about on the podcast. So yeah, we're going to be talking about kind of navigating the health system, especially as it relates to not wanting to like be weighed or not wanting to talk about weight loss with a provider. So kind of what some of our tips are, some things to think about. And we definitely want to start out just by acknowledging the fact that Randy and I both Randy, you live in a very small body, both short.
I think we've talked about this. I should not be in the front seat of a vehicle because I'm 4'10". So,
So Randy's also very short, but acknowledgement of the fact that we both have thin privilege. We don't have the experience of living in a larger body. And I just like to acknowledge the fact that like this shouldn't even have to be a conversation that we have to have. I think that's really important. And again, as more information and gets out there about the harms around, weight bias and healthcare and everything, and more providers start to practice from more of a health at every size model or framework, things will start to shift, and hopefully, in 5, 10, 20 years, we won't even be hearing about this. But until that point, yeah, I think it's worth us talking about. A couple other things before we dive in. A really great resource for this topic is Reagan Chastain. She is a writer and a speaker and just a really, really, really my go-to resource for this. And in fact, when I was kind of considering what points I wanted to bring up today, I checked out her website and I actually signed up for her newsletter. She's a really great newsletter. She also has an appointment action plan on her website. So for people who specifically, who live in larger bodies. So we will link that in the show notes for sure. But yeah, so we're going to talk about this. It's an important topic too, because for obvious reasons, but unfortunately, I think healthcare providers are some of the most common perpetrators of weight stigma. And we know that can lead to eating disorders, disordered eating disorder relapse. And it can also cause people who live in larger bodies to delay getting treatment or prolong their symptoms due to just fear around what is my doctor going to say to me, or experiencing weight stigma or shame. There's also this research that shows many folks who live in larger bodies, they have their symptoms can be the exact same as somebody that lives in a normal sized body, and their symptoms are ignored or they're not really taken seriously at first due to their body size. So lots of research behind this, and Randy and I were just talking before we hit record. We're going to put some of that research in the show notes too. Probably won't find all of it, but just, some references for you all to learn more if you want to and see that.
A good starting point, I think, to at least, I know some people when they do see their physicians want to have some non-Google references to point back to. So we'll try to round up some of those.
Yeah, I love that. So first and foremost, and Randy, I definitely want to get your take on this, because from my perspective, or it's from my understanding that in most cases, getting a weight really isn't super necessary for when you go to the doctor, unless if you have a specific condition where fluid retention can be really common. So is it edema or whatever, where, swelling and fluid retention, or for medications, if specific medications require the dose is related to the weight or whatever. So yeah, I'd love to hear more of, put your pharmacy hat on.
Right, right. So yeah, there are going to be certain medications where a weight is necessary for dosing it correctly. So, and some medications are dosed totally independent of weight also. And then some, you really just need a good starting weight to get the medication started. And then you just adjust based on how you're responding to it. So there's lots of different variables and scenarios, but I think the most universal recommendation I could give to somebody who's wondering, like, is weight important for my medications, would be obviously to talk to your doctor or your pharmacist to find out how your medications are dosed, and how important it really is to know your exact weight at a certain point in time for like the dose adjustment process. And if you're lucky enough to go to a place where, a pharmacist is on staff in the clinics, like the University of Iowa has a pharmacist on staff in their internal medicine and family medicine clinics, you can set aside a time to speak with a pharmacist about your medications and like learn all that stuff. You can talk with your pharmacist at Hy-Vee or, wherever, knowing that you might have to set up a separate time, so that they can dedicate that time to you. But unfortunately, providers in today's medical world usually have like 15 minutes to be with you. That's just,
Right.
it's not their fault. It's all they're given. And so you really only have time to focus on one thing at every appointment. And in a lot of cases, it might be something a little higher on the list than, dosing your medications based on weight. So setting up a separate time to talk about something like that, I think is something to consider too. But yeah, you can kind of take the driver's seat in knowing how important weight measurement really is when it comes to your medications and your health conditions too. Like that, like you said, edema, like if you have congestive heart failure or something, that then your weight's very important. You should be doing it daily. But beyond that, it might not be that important.
Yeah. And I also, one thing I wanted to say that I didn't, but what you mentioned jogged it in my mind. The fact that healthcare providers are such large perpetrators of weight stigma, I don't mean that, I don't mean to say that to like shame healthcare providers, because like you mentioned, they only get so long with each patient and it's very minimal. And not to mention their training is still very based in a weight-centric conventional medicine model. So that being said too, I mean, hopefully if there are any healthcare providers listening and you read some of the research that we share in the show notes, once you know better, you can do better too. So yeah, that's helpful. So I was kind of thinking about this, like, how can we break this down before appointment and like during appointment, specifically around like a weigh-in or like the weight aspect of it. And one thing, and I've helped some folks do this before, is if you're wanting to maybe switch provider or you're looking for a new provider, consider looking at the Health at Every Size provider registry. Again, that'll be linked in the show notes. But it is not an all-inclusive list, absolutely not. And I know that, so I'm in an intuitive eating counselor like Facebook group, all the certified intuitive eating counselors are in there and they're constantly like reaching out for referrals in different areas or like, hey, checked the registry, no one's in this area. No HAES provider in this area. Does anybody have a connection? So I've actually posted in there a couple times for folks who either listen to the podcast or know me personally and are looking for a HAES provider. So check out the registry, or again, if you do look at the registry and you don't see anybody in your area, I mean, feel free to reach out to me and I can post something in the intuitive eating group, just see if there's anybody that has a connection. But yeah, I think before the appointment, looking at the registry, before setting up an appointment, seeing if you can find a provider that is HAES aligned from the get-go, I think would be really helpful. That would just, reduce having to do a lot of shit.
Yeah, for sure.
Yeah.
Do you know offhand, if there are any like in our immediate area for like the local listeners, like the Iowa City, Cedar Rapids area?
That's a really good question. I know of some, maybe not just like primary care physicians, not necessarily. I mean, obviously I know like at student wellness or at student health at the university for students, there's at least one that I always refer to. But yeah, maybe that would be helpful too to put them on. I know like certain physical therapists I've worked with, like Dr. Mary Hausler, who hopefully everybody recognizes that name, our pelvic floor specialist, pelvic floor
Yes.
PT that was on, who she was just a hoot. She's definitely, you know, Haze aligned.
Mhm.
And I think too, like a lot of people are, they're maybe not like health at every size aligned, but like they'd be helpful for this conversation. They're not going to be like poking around your weight and everything. Like if you
Yes, they're
bring it up,
open-minded to
yes.
yeah, for
Yeah.
sure.
But yeah, and I think one thing that you can do to kind of figure that out is call ahead and discuss it when you're scheduling an appointment. You can let them know, like, do you have like health at every size aligned providers, or letting them know, like, when you're scheduling the appointment, can you make a note in my chart that says, like, I don't really want to discuss my weight? Can this be respected? Like, I think there are some upfront things, unfortunately, that I say unfortunately, but fortunately, that you might be able to do to maybe get your to reduce you having to do it like in person while you're there, right? Like, can you put a note in
Sure.
my chart or something like that? I don't
Yep.
know if from your perspective though, Randy, like would they actually see that? Like, would that be something,
That's
you
what's
know?
kind of tricky. It's kind of hard to have something like that's blatantly seen on your chart for everybody. Sometimes it's like department specific on who can see
Mm,
it, which that's just, it kind of gets in the weeds of the electronic medical record. But,
right.
um, I think doing your best to do all that, that's an excellent way to get started. You just know that you might have to remind people, unfortunately, until you've maybe been there a couple of times and it's more prominent in your chart.
Mhm.
Because once you've been a patient somewhere, it's generally easier to kind of see that information more readily versus if you're brand new, there's not really a good place for that to be like displayed, if you will.
Okay.
Which,
That's
yeah, it
helpful.
kind of stinks that it might have to come up a time or two, but it's not necessarily, the providers or the staff out to get you. It's just the limitations of
The medical
freaking
records.
technology. Yeah.
Yes, freaking technology. Yeah. So that's, I don't know, that's what I would say for like before an appointment. Anything else that you can think of like beforehand that people could do to, you know, help them feel more prepared for like the weigh-ins or anything like that? Again, maybe from like your medical perspective.
Sure. This isn't from my medical perspective. This is from my social media experience perspective. But you mentioned, the group on Facebook, but it made me think of like really any group you're in on Facebook now,
Mhm.
you can post anonymously. And if you have a good like community, like there's some like, local community moms groups or just like, whatever, you can ask, does anybody have any experience with providers who are open to not addressing weight and things like that? And you might be able to get some recommendations of, like you said, somebody who might not be like on the health at every size registry but might be aligned with that,
Yes.
and you
Hmm.
know be open to those kinds of discussions with patients. So
Yeah, I like that idea. So even using like your own Facebook groups or resources, that's helpful because again, more people are looking for that kind of care. So I love that. So then during the workout, or not workout, during the appointment, LOL, during the appointment, a couple different things. So, oh my gosh, let me actually grab this real fast.
okay.
Um, I guess people aren't going to be able to see this unless they're watching it on YouTube. But we have the dietitian that I work with actually got these cards for to give out to students that they say, please don't weigh me unless it's really medically necessary. If you really need my weight, please tell me why so that I can give you my informed consent. And then on the back of the card, it gives them a bunch of reasons why. Like, why am I doing this? So I think this can be like when you get really nervous, I mean, this can be a go-to
Yeah.
resource, or I don't know if students have actually used them, but I mean, it's a whole lot easier to just like awkwardly hand this to like the
And whip
nursing
out a
staff.
card. Yeah.
Yeah, or like an MA. Um, and it just says like, please don't weigh me unless you actually have to for my condition or for what I'm coming in today. So, I mean, feel free to pick up some cards like that. I mean, absolutely. But I
Yeah.
also think you can think about how you want to potentially decline being weighed because you're going to get weighed, right? Like most places, that's going to be part of the practice. And I think it could be something as simple as like, can I actually skip the weigh-in today? I'm not feeling it. Like if you don't want to go in depth. Or it could be as something like, I actually have a history of an eating disorder or disordered eating or body image concerns, and I have been advised not to have my weight checked. You don't have to say like it was my therapist, it was another provider, it was my favorite podcast host, but like literally just put it on someone else. Like I have been advised by a different provider not to get my weight checked for these reasons.
I was advised by my past self not to get my weight checked.
Many, like little Haley told me that I really shouldn't step on the scale today.
Yeah.
But yeah, so I think, and again, I know that can be it can be really scary, but I feel like if we can put the blame on someone else, like a different provider advised me not to do that, then, and I feel like if you say, I have a history of any sort of concerns related to like weight or body size or eating food, whatever, again, they damn well better respect that. And if they don't, like, I'm going to write a review on Yelp. You know what I'm saying?
Right.
Yeah.
And another way I think you can do that too is like knowing that the person weighing you is probably a nurse or medical assistant or nursing assistant. They aren't there to, at least the assistants aren't there to make decisions. They're there to check their boxes on what they need to do to prepare you for the provider. So they need to get your weight, they need to check your vitals and, you know, answer a couple questions, and that's that. And so if you can approach it with them so that they aren't having to make a decision, I think that's helpful. So like if you say, you know, I don't want to get my weight today, they're like, is that allowed? Can I say okay to that? You know, they have to make that decision. Whereas, you know, if you say, hey, I just want to talk with the doctor first before I get my weight, they're not having to make like a, we're doing this today or we're not decision. It's like, we're putting this on pause until I chat with the doctor.
I like that.
Yeah, I think it just might like put them in a better position to where they're not going to push back on you, I guess. You know, it's not to make other people comfortable, but I feel like it's going to be less of an awkward scenario for you as well, because it's like you said, pushing it off on somebody else or a different time or something like that. It kind of takes the pressure off of everybody.
I like that. Yeah, I really like that tip. And it makes me think too, again, this isn't the same in every space, but a lot of places have the scale like in the room that you're going to be meeting with the doctor. Like I think about like for example, where I'm going for my baby care, right? Like it's the actual exam table now. They weigh you while you're sitting on it, which is like so cool to me. They're like, we're going up, and then they get your weight. And so I can see how it's like it's not like the scale's outside of the room and the doctor's going to have to like take me back outside the room to get me weighed. Like if they decide I still need to get weighed or whatever that is. So yeah, I really like that idea. Can I talk with the doctor first about something before getting my weight checked? Love that. I also wanted to think about like, okay, so if there is pushback, and again, I think this comes from Reagan Chastain's website. I loved this kind of phrase that she included was, if there is pushback, you can say something like, you know, if we do find that my weight is medically necessary, then I'll be willing to discuss it and figure it out. Otherwise, like, you know, not right now. So I think it's the acknowledgement of, if this does need to be part of my plan of care or my care plan or whatever, then we can go into it. But otherwise, like, yeah, I'm just going to skip the weigh-in today. Like, I think that acknowledge it, because it's in a way it's saying like, I understand that sometimes weight is necessary to know about. I'm not completely, you know, whatever, saying that it's not. But also it probably isn't. You know?
But also, right.
Yeah. So I really liked that idea of, if we find out after I meet with the doctor that like I do need to get my weight, I'm happy to get it done. But until then, like, let's just skip it. You know, I think that's a good thing that you can say.
Yep, for sure.
And have you ever done a blind weigh-in or done like stood backwards on a scale or anything?
I haven't, but I've had patients do that. They're like,
Okay.
I don't want to know the number. I don't want to see it. That's fine. Back on in. Well, I'll just
Back
write
on
it
in. Scoot on back here.
Yep. Which
Okay.
now thinking back, like I wish I would have known what you know, because when I brought my patients back, I weighed every one of them because that's what I was supposed to do. That was my checkbox, you know. Like
Mhm.
sometimes it's just people are on autopilot and that's what you're supposed to do. And, our goal is to change that so that, it's not standard for everybody because it's not necessary for everybody. But
Mhm.
sometimes
Yeah.
that's just the case.
Yeah, and I think too that again, when we are on autopilot, we don't really think twice. Like this is just my method of going through it. But yeah, that's something that I've heard a lot about of people doing is like a blind weigh-in or stand backwards. And I think so. I just met with a student yesterday who this conversation is so timely because I started meeting with her because she was referred to me by a physician for weight loss, even though she got a full blood panel done. Um, Nothing was abnormal. Nothing was
Yeah.
abnormal. She didn't go into the appointment curious about weight loss. Even like by BMI, she was quote unquote overweight, but like, I mean, and she got referred to me for fitness
Yeah.
for weight loss. Yeah. And so she's been wanting to go back to get a yearly physical and to check in on, just because once she does preventative
Mhm.
health measures, she's been so nervous about doing it and so nervous about seeing that same doctor. So I referred her to a different doctor who works with more like eating disorder patients and everything. And she came back yesterday after she got her physical and we checked in, and I don't remember, I think she ended up standing backwards on it. The nursing assistant or MA was totally cool with it. And not only that, because she told him, like, I don't really want to see my weight. When she stepped off the scale, they zeroed it out before she could even see it.
Oh, yeah.
So, yeah, I think like that's been a more acceptable practice than saying I don't want to get weighed. So if the idea of telling somebody I don't want to get weighed is like really nerve-wracking, just ask if
Yeah.
you can do a blind weight or like, can I say it backwards? Like, I don't want to see it today,
Yeah.
And I think that'll go over smoothly with most people. That doesn't prevent you from not seeing the number though, right?
Yeah. The stinking printouts that you get these days.
Yeah. So, and I know that was something that you put on our notes, like,
Yep.
yeah.
Yeah. So, I mean, at least all my experiences from the University of Iowa, but they're actually like for a while they were required to print the after visit summary, like even if they wanted to save paper, they're like, no, you have to print it. Now I think they do have the option not to print it, but even if they do, you can say, no thanks, don't need it. But if you do have access to like my chart or your electronic medical record, you might still see it there, depending on
Yeah.
where you look. I don't
Yeah.
think it's like pasted front and center when you log in though. I think you do have to go to a certain spot to see it. So, just being mindful of that and preparing yourself, before you go look at whatever you're looking for.
Yeah, yeah, and that was something that the student that I met with that she said too. She was like, "It was so great. I didn't know my weight at all, and then they gave me my after visit summary, and it was right there." I was
Yeah.
like, "Yeah, that does suck." And unfortunately, that's another technology thing. I don't know how the process goes of getting that removed or whatever it is, but maybe it's like you said, just asking not to see it or not to get a printout if that's possible. And then if you do have like an app for folks who live around our area, my chart is regularly used, just not going in to look at it, or going in to look at it and making sure that you're prepared to do some self-care potentially afterwards or something like that. Like what am I going to do if I see that this number is not what I wanted? And then I think another thing that I thought about too is if you have a really hard time advocating for yourself, take someone with you, like to the doctor if you can. I think this could be especially helpful if you have a friend or someone, I don't know what the rules are, like who can come into my visit with me, but if you have someone that like lives in a smaller body and is willing to advocate on your behalf, like that's our job as people that have thin privilege. So again, I don't know about like rules of having somebody, a companion with you, but if you can just have someone else there that can kind of support you, and it just helps you feel more comfortable when you're going to have like a potential uncomfortable conversation or approach conflict in some way. Maybe consider what that might look like too, I guess.
Yeah. Yeah. I think that's a
Again,
good tip.
Yeah, don't know if it's possible, but and then we also wanted to talk a little bit about, okay, so maybe you do get weighed or you do the blind weigh-in, or maybe you don't even get weighed and a provider still brings up the fact that weight loss, like to help you out, weight loss, right? Because we know that even if they don't know your weight,
Mm-hmm.
if they perceive you as being overweight or unhealthy, right, because of your body size, it's likely that weight loss is going to be brought up. And one of my favorite things that I don't know where I saw this, it was probably from Reagan Chastain, is ask your provider what intervention or what their recommendation would be if you were a thin person. Like, would you still recommend this intervention for somebody that lived in a thin body? I feel like that's like a mic drop question.
Right? I
Yes.
saw this on your notes for this episode and I was like, oh my God, I love this. I actually wrote, OMG, I love this.
I know. I'm looking at it now.
Well, and
Yeah.
because because one of the like questions along with that is, do thin people get this same condition?
Yeah.
And the answer is probably 99.9% of the time, yes, they do.
Mhm.
And in that case, what do you prescribe them? Because it surely isn't going to be weight loss. I just like that blows my mind. Like I never thought about it in that way, but I just love it.
Yeah, and I think that asking it in that way, like, do thin almost in like a, oh my God, like, do thin people get this too? You know, like knowing
Yeah.
damn well that they do.
Yes.
But seeing how, you know, approaching it with like curiosity rather than
Mhm.
well, what the heck would you recommend if I was thin? Right? Like I can
Yeah.
see how that approach would
Right.
be maybe come off a little bit better.
Yeah.
Yeah, so I love that idea. And again, not something I've ever had to think about because I don't live in a larger body. But yeah, do thin people get this? And like what's the recommendation for them, right? Like are they
Yeah.
recommended to still lose weight or whatever it might
Yeah.
be? So
And I
would
think it
love
just
that.
shows them too that you're kind of thinking critically about it. You know, you're being your own advocate. So
Yeah.
I really like that. Um, and one of the things that I'm hoping we can maybe point you in the general direction in the show notes is like what references you can bring or discuss or reference yourself in the visit about, you know, we've talked about how studies have shown that just like diets don't work, the weight always comes back, and more than likely it's the yo-yo of the weight loss, weight gain, weight loss, weight gain that actually leads to a lot of the problems we think are associated with being overweight or obese. And so, you know, just having that to discuss with your providers, I think could change the conversation.
Mhm.
Um, I want to say that they talk about these references in the intuitive eating handbook, maybe.
Yeah.
So if you have that or have access to that, that might be a good place to just find some of those studies referenced,
Mhm.
so that you can kind of look into those yourselves if you're interested. But I just thought when I first heard about like those studies, that was really eye-opening to me.
Mhm.
And I'm guessing there's providers out there that don't know that. So that could be a good point of discussion.
Yeah, I love that. Yeah, we have so when you go through the certification process, you get like I don't know how many studies Evelyn sends you. But I
Mhm.
have an entire folder of the studies that she has like the PDF shared. So I don't know if I'll be able to put the PDF in the show notes. I don't know how the heck that works.
Yeah,
Um, but I might be able to at least put the reference in there and then hopefully people can access it. But I know some of them require certain credentials or, you know, to pay
sure.
or whatever, but at least putting them in there and showing, you know, there are studies that show this or whatever it might be. I agree. I think again, almost like having one of these cards in your back pocket that don't weigh me unless it's medically necessary because of all these
Yep.
reasons. It just helps us feel way more prepared, right? Like going into it. Like, okay, I have research on my side. Like,
Yes.
you know,
Yes,
yeah.
absolutely. And yeah, you don't need to know these studies inside and out, but I think if you can just find a blurb, a summary of it, just to kind of prepare
Mhm.
yourself, like you said, a little bit for some talking points, just to have that discussion, I think is
Yeah.
key.
Again, with this one, a quick overview of kind of what Randy and I put together in terms of navigating the health system in a from a non-diet or like weight neutral perspective and how to handle the discussion of weight or like the weigh-ins, whatever it might be. I think that I would totally be open to hearing more people's perspectives on this though. And if you're open to sharing your experience and what has worked with you, and maybe some things that like, yeah, I tried this and it did not go over well. Obviously that's very dependent upon practice and everything. Or if you are, I mean, regardless of what area you're in and you're listening, if you have providers that you know are weight neutral and are open-minded to this type of thing, feel free to let us know as well, whether you're in the Iowa City, Coralville, Cedar Rapids area, or you're somewhere else. Like, I think if, as long as we can share that somewhere, might as well. So
Heck, maybe they'll even be a guest.
oh my God.
You know?
Yeah. Ooh, that would be a good idea. I love that.
Yeah.
Okay, so finding a weight neutral provider to chat with. Absolutely. Yeah, so if you have a provider who you were like, they fucking knocked this out of the park, let us know. We want to talk to them. Absolutely. Love that idea, Randy. Yeah. So as always, reach out to us with questions, with thoughts, anything that comes up. Definitely a conversation that we need to keep having. And we'll put all of the things that we referenced in the show notes for you. Reach out with whatever you got for us, and we'll see you back here in another week. And we can't wait for then. Yay!
Yay!
Yay! Thanks for tuning in to the Give 'em the Bird podcast. If you're enjoying the podcast, head on over to Apple iTunes or Spotify and rate, review, and subscribe. Be sure to follow us on Instagram at Give 'em the Bird podcast to stay up to date with all things GTB. We'll see you back here next week for another episode, but in the meantime, go give 'em the bird.